Hello and welcome to Health. Before we dive into today's video, don't forget to hit that like button, share this video with your friends or loved ones, and subscribe to our channel. Your support really helps us bring more valuable content your way and gives us the motivation to create even more helpful videos for you. Now, here's a question for you. Have you ever taken vitamins to improve your health, whether for your bones, circulation, energy, or overall well-being? While these supplements can be beneficial, what if I told you that taking them in high doses could actually put your health at risk? That's right. What if those vitamins you've been taking to feel better could actually lead to serious side effects, like an increased risk of stroke, brain issues, or even nerve damage? In today's video, we're going to explore the potential dangers of overusing certain common supplements, the unexpected consequences they can have, and how to take them safely to protect yourself from harm. Risk of stroke due to vitamin D. Vitamin D is commonly used by older adults to support bone health, boost immunity, and improve mood. While it's essential for calcium absorption and overall health, taking too much vitamin D can actually increase the risk of a stroke. Many seniors take high doses of vitamin D, thinking they're doing something good for their health. But in reality, it can lead to dangerous calcium buildup in the bloodstream, stiffening the arteries and raising blood pressure, ultimately increasing the risk of a stroke. Take the case of Mr. Walter, a 74-year-old retired Navy veteran from Florida. He took a 10,000 IU vitamin D supplement every day, believing it was helping his bones stay strong. However, one morning his wife found him confused, unable to speak properly, and with his right arm limp. He had suffered a stroke overnight. His blood tests revealed dangerously high calcium levels that had stiffened his arteries, causing high blood pressure and creating the perfect environment for a blood clot to form. This clot ultimately traveled to his brain and caused the stroke. So how does this happen? When you take high doses of vitamin D, it increases calcium levels in the bloodstream. The body doesn't know how to handle this excess calcium, so it deposits it into the arteries, causing them to become stiff and less flexible. This restricts blood flow, which raises the risk of a blood clot forming. That's when the danger of stroke becomes very real. Many older adults aren't aware of the risks that come with oversupplementing vitamin D. Do you know how much vitamin D you're taking? Have you ever checked the label on your vitamin D bottle? It's important to remember that just because a supplement is available over the counter doesn't mean it's safe, especially if it's not taken in the right amounts. More isn't always better. Taking too much can do more harm than good. It's also important to think about when you're taking your vitamin D. Taking large doses at night can lead to calcium spikes while you sleep, which makes you more vulnerable to high blood pressure and stroke risk. This is especially true as we age and our bodies become less efficient at processing nutrients. I've seen this firsthand in my practice. A number of my patients, especially older adults like Mr. Walter, have taken vitamin D supplements regularly without realizing the potential dangers. Have you spoken to your doctor about the right vitamin D dosage for you? If you've been taking a high dose, it's worth discussing with your healthcare provider to make sure your vitamin D levels are in a safe range. In conclusion, it's critical to take vitamin D in moderation and always under medical supervision. Regular checkups, blood tests, and paying attention to your body's signals are important, especially as you get older. While vitamin D is crucial for health, the best way to get it is through food sources like fatty fish, fortified dairy, and egg yolks, rather than relying too heavily on supplements. So the next time you grab your vitamin D bottle, ask yourself, Am I really doing what's best for my health, or could I be putting myself at risk? Vitamin E and brain bleeds. Vitamin E is commonly used by many older adults to support heart health, improve circulation, and even boost skin health. However, what many don't realize is that taking high doses of vitamin E, especially when combined with blood thinners, can significantly increase the risk of a brain bleed. Vitamin E acts as a natural anticoagulant, meaning it can reduce the blood's ability to clot. While this might be helpful in some cases, it can also make seniors more vulnerable to serious complications like brain hemorrhages, especially if they're already taking blood thinners for heart conditions. Let me tell you about Mrs. Evelyn, an 81-year-old retired librarian from Ohio. She had been taking vitamin E for years to support her heart and memory. She also took warfarin, a blood thinner, after having a heart valve issue. Mrs. Evelyn's doctor was closely monitoring her health, and her blood pressure and heart were stable. But 3 weeks after she started taking a new bottle of natural vitamin E, which contained 800 IU per capsule, she suddenly had a severe headache, was confused, and started vomiting. When she was rushed to the ER, a brain scan revealed that she had suffered a hemorrhagic stroke. The cause wasn't high blood pressure or a fall. It was the combination of warfarin and high-dose vitamin E, which made her blood too thin and caused a blood vessel in her brain to rupture. Does this sound familiar to anyone? Have you, or someone you know, been taking vitamin E regularly for heart health or other reasons? It's easy to assume that vitamins are completely safe, but this case shows how dangerous it can be when vitamin E is combined with blood-thinning medications. I've seen similar situations with many of my older patients. Mr. George, another patient of mine, was taking vitamin E for heart health while also on blood thinners. He didn't connect the dots between the two, and after a minor fall, he ended up with a brain bleed. It wasn't life-threatening, but it did leave him with long-term balance issues that he never fully recovered from. It was a painful reminder that vitamins, while helpful, can sometimes have unintended consequences. Now, here's the thing. Vitamin E works as a natural anticoagulant, which is great for heart health, but not so much if you're on medications that already thin your blood. The problem is that many vitamin E supplements contain much more than the recommended daily intake for seniors, which is about 15 mg or 22 IU. Many store-bought supplements contain 200 IU, 400 IU, or even higher doses, which can put you at risk of bleeding problems, especially if you're already on blood thinners. How many of you have checked the label on your vitamin E supplement lately? Are you sure it's within the safe limits, especially if you're on heart or blood pressure medication? It's crucial to be aware of how much vitamin E you're actually taking. For seniors, high doses can be dangerous, and if you're on medication like warfarin or aspirin, it can increase the risk of internal bleeding, even in the brain. If you're taking blood thinners or any other medications that affect your blood, it's important to monitor your vitamin E intake carefully. Talk to your doctor about the supplements you're taking to make sure they're not interacting negatively with your medications. Unfortunately, Mrs. Evelyn's doctor didn't foresee the risks of combining warfarin with high-dose vitamin E, and the result was a stroke. Has your doctor reviewed all the supplements you're taking? Be sure to share every supplement, no matter how harmless it may seem, with your healthcare provider. It could be a game changer in preventing serious complications. In the end, vitamin E isn't bad. It's a helpful antioxidant that can support heart health. But like anything, it needs to be taken in the right way and in the right amounts. Have you ever looked at the vitamin E dose on your bottle? If you're on blood thinners or managing heart disease, it's essential to make sure that you're not unknowingly increasing your risk of a brain bleed. Always talk to your doctor before starting any new supplement, especially if you're already on medication that affects your blood. Your health should always come first, and with the right information, you can make sure that the vitamins you take are truly benefiting you. Vitamin B6 and nerve damage. Vitamin B6 is often taken by older adults to support nerve health, boost energy, and improve brain function. It's commonly found in supplements marketed for nerve support or overall well-being. However, many seniors don't realize that taking too much vitamin B6 can actually cause permanent nerve damage. This can result in numbness, tingling, muscle weakness, and balance problems, which are frequently mistaken for signs of aging or arthritis. Take the case of Mr. Harold Jenkins, a 76-year-old retired truck driver from Kansas. Harold started taking a nerve support supplement that contained 100 mg of vitamin B6 per tablet, which is well above the recommended daily intake. He took 2 tablets every day, totaling 200 mg of B6 daily, about 10 times the safe upper limit for seniors. Over time, Harold began experiencing numbness in his feet, tingling in his hands, and balance issues. At first, he thought these were just signs of getting older, but after a bad fall, he visited his doctor. It turned out that his high B6 intake had gradually damaged the protective covering around his nerves, leading to permanent nerve damage. Now, Harold needs a cane to walk and struggles with his balance. Have you ever experienced numbness or tingling in your hands or feet? Did you think it was just part of getting older? These are some of the first signs of B6 toxicity, which can lead to irreversible nerve damage if not caught early. Unlike some vitamins that your body can easily flush out, B6 builds up in your system over time, and it can take months or even years before you notice the effects. Most people don't realize how much vitamin B6 they're actually taking. The recommended daily intake for seniors is only 2 to 10 mg, but many supplements contain 50 mg, 100 mg, or even 200 mg per serving, well above what's safe. If you're taking a supplement like this, it's important to check the label and make sure you're not exceeding the safe limits. Have you checked how much B6 is in your supplements? If you're taking nerve support formulas or energy boosters, you might be getting more than you realize. How often do you talk to your doctor about the supplements you're taking? If you've been using high-dose B6 supplements, it's a good idea to discuss it with your healthcare provider. They can help you make sure you're not putting your nerve health at risk. If you're noticing any symptoms like tingling, numbness, or balance problems, don't wait. Talk to your doctor to see if B6 toxicity might be the cause. In conclusion, while vitamin B6 is essential for health, too much can lead to serious, irreversible nerve damage. It's important to take it within safe limits and be mindful of your supplement intake. If you have any concerns or notice symptoms, be sure to talk to your doctor. It's always better to be safe and stay informed about what you're putting into your body. Vitamin A and increased pressure on the brain. Vitamin A is crucial for good eyesight, skin health, and immune function, and it's commonly found in supplements designed to support vision, skin health, and aging gracefully. However, what many people don't realize is that too much vitamin A can be dangerous, especially for older adults. High doses of vitamin A can lead to increased pressure inside the skull, mimicking the symptoms of a stroke and causing serious issues, including permanent vision loss or cognitive decline. Take the case of Mrs. Dorothy Simmons, a 79-year-old retired piano teacher from Oregon. She had been taking a skin and eye supplement that provided nearly 10,000 IU of vitamin A per day, well above the recommended daily amount for seniors. She thought it was helping her maintain healthy vision and skin, but after years of taking high doses, she started experiencing constant headaches, blurred vision, dizziness, and slurred speech. Her family feared she might be having a stroke, but when doctors ran tests, they found no stroke, no clot, and no bleeding. What they did find was that her high vitamin A intake had caused pseudotumor cerebri, a condition where increased pressure inside the skull mimics the effects of a brain tumor. This condition can result in permanent vision loss and cognitive problems if left untreated. While Mrs. Simmons is slowly recovering, she now needs regular eye exams and pressure checks. Have you ever taken vitamin A supplements for your eyesight or skin health? If so, you may be at risk of taking too much without even realizing it. It's important to understand that vitamin A is fat-soluble, which means your body doesn't flush it out like water-soluble vitamins. Instead, it builds up in your liver and tissues, including the brain. When this happens, it can increase intracranial pressure, causing symptoms like headaches, dizziness, blurred vision, and confusion, symptoms that are often mistaken for a stroke. How much vitamin A are you taking? The recommended daily intake for seniors is typically around 2,500 to 3,000 IU, and this is usually sufficient for most people. However, many supplements contain 5,000, 10,000 IU, or even more, which can easily push your intake into dangerous levels. If you're taking multiple supplements, you might not realize how much vitamin A you're getting in total. Do you check the labels on your supplements? Many multivitamins already contain the recommended amount of vitamin A, so adding extra supplements for skin health, eyesight, or anti-aging can push your intake too high. Have you ever considered how much vitamin A you might be getting from your food? Foods like carrots, sweet potatoes, and spinach are all great sources of vitamin A, and you may not need additional supplements. If you've been taking high doses of vitamin A or are concerned about your vitamin A intake, it's important to talk to your doctor. Your healthcare provider can help you determine if your vitamin A levels are safe and help you avoid potential problems. Mrs. Simmons' case is a perfect example of how something as simple as a vitamin supplement can lead to serious health issues if not taken properly. In conclusion, vitamin A is essential for good health, but too much can cause severe health problems, including increased pressure on the brain and permanent vision loss. Always be mindful of the dosage in your supplements, and check with your doctor if you're unsure about how much vitamin A is safe for you. Have you checked your vitamin A intake lately? If you're experiencing symptoms like headaches, blurred vision, or dizziness, it's a good idea to get checked and make sure you're not taking more vitamin A than your body can handle. Niacin, vitamin B3, and blood pressure spikes. Niacin, also known as vitamin B3, is commonly used to help manage cholesterol levels and support heart health. Many people, particularly older adults, take niacin to lower bad cholesterol and improve circulation. While it can be beneficial, what many people don't realize is that high doses of niacin can cause dangerous fluctuations in blood pressure, which could potentially lead to a transient ischemic attack, TIA, or a mini-stroke. These sudden swings in blood pressure can cause your blood vessels to expand too quickly and then constrict, which can lead to serious issues like a stroke. Let me give you an example, Mr. Frank Miller, an 82-year-old retired postman from Florida, had been taking niacin for several years to manage his cholesterol. He followed his doctor's advice, and started taking a supplement with 1,000 mg of niacin twice a day. After a few weeks, Frank began experiencing strange symptoms, hot flashes, a pounding sensation in his chest, and dizziness. His family thought he was just anxious or that it was a side effect of his blood pressure meds. However, when he went to the doctor, he learned that the niacin was causing his blood pressure to spike and drop, leading to a transient ischemic attack, TIA, also known as a mini-stroke. Thankfully, Frank recovered without long-term damage, but it was a serious wake-up call. Do you take niacin for your cholesterol or heart health? If you do, you might not realize that high doses of niacin can cause harmful spikes and drops in your blood pressure. A lot of seniors believe niacin is completely safe because it's often recommended by doctors for cholesterol management, but it can cause major issues, especially when combined with other medications for heart disease or high blood pressure. What makes niacin so tricky is that it causes your blood vessels to dilate. In moderate doses, this can be helpful, but in high doses, it can lead to too much dilation, followed by a constriction, which causes sudden fluctuations in blood pressure. This can be particularly dangerous for older adults who are already dealing with heart issues or taking medications to manage blood pressure. How much niacin are you taking each day? Do you know if your dosage is safe for you, especially if you're on other medications? In my experience, a lot of seniors don't realize that even flush-free or extended-release niacin can still cause blood pressure changes. Have you experienced dizziness, hot flashes, or chest discomfort after taking niacin? These could be signs that your niacin is affecting your blood pressure in a harmful way. If you're already taking medication for heart conditions, it's crucial to talk to your doctor before adding niacin to your regimen. For seniors, it's important to never self-prescribe niacin for cholesterol control, especially if you're already managing other health conditions. Niacin can have serious side effects, and it should always be taken under medical supervision. Do you regularly discuss your supplement regimen with your doctor? It's important to be open with your healthcare provider about everything you're taking, whether prescribed or over-the-counter, to avoid any negative interactions. In conclusion, niacin can be a great tool for managing cholesterol, but high doses can cause dangerous blood pressure swings, which can lead to mini-strokes or full-blown strokes. Have you checked the dosage of niacin in your supplements lately? If you're dealing with heart or blood pressure issues, make sure to talk to your doctor about how much niacin is right for you. Always be cautious and consult your healthcare provider to ensure that you're using niacin safely and effectively. And that's it for today's video. We hope this information helps you stay informed and make better choices when it comes to the supplements you take. Remember, while vitamins can be beneficial, it's crucial to be mindful of the dosage and always consult with your healthcare provider, especially if you're taking other medications. If you found this video helpful, don't forget to like, share, and subscribe to Health for more content like this. Your support means a lot and helps us bring even more valuable tips to help you live a healthier life. As always, thank you for watching, and we'll see you in the next video.